Okay, here. Hello, I'm Dr. Anderson, Executive Director of TOVA Community Health. I have here today a phenomenal social worker to explain all things holistic about preventing yourself from going stir crazy during this pandemic. I have Mr. Norwood Coleman, who is a licensed clinical social worker at the Life Center. I graduate from Delaware State University, and may I say, also a musician extraordinaire. He plays the violin, the viola, the piano, all at a very high caliber, and is the founder of Umoja Strings, which I have had the opportunity to play with as a violinist. So today on TOVA Tuesdays, we want to talk about all things health and wellness, anything that we can do to improve your overall health and wellness. And I think this is a great time to talk about how we can really maintain and or improve our mental health state during a time of pandemic. So without further ado, I want to introduce Mr. Norwood Coleman. Hi, Norwood. How are you today?
I'm doing well. Thank you, Nina. That was a wonderful, wonderful introduction. I'm not sure who that guy is that you just introduced, but I'd love to meet him. He sounds wonderful.
So, Norwood, tell us, what is a licensed clinical social worker?
A licensed clinical social worker actually is a master's degree social worker who has several years of experience as under supervision, and really, actually, really the important thing is the license is that a licensed clinical social worker goes to the state of Delaware, does some things, takes a test, demonstrates what their experience and work experience is, and they dedicate their career to protecting the public. That's what the purpose of the license is a demonstration that our job is to protect the public.
Mm-hmm. So just to expand a little bit more to our audience, you can do case management services, care coordination services, but you can also provide therapeutic counseling to your clients. Is that correct?
That's correct. In my practice, I provide therapy for clients. I primarily work with children and families with a specialty in trauma treatment. I also provide, really important work. And I also provide case management, which is the work that outside of the therapy, helping people to connect to services. The therapy, I think, is important. It does the work with helping the person to manage thoughts and feelings and behaviors, but there's so many other factors outside of just the individual that impact their life. Finding help resources, finding services, finding resources to help them, maintain their life and, beyond just their basic needs. And that's what case management is able to do, is help them to connect and make sure that all those services that is working and connecting with the client or the patient, that they're working together, that things are coordinated.
Wow, that's really important because, as you know, as a healthcare provider, we really rely on social workers to provide that level of comprehensive care to our clients. So I just want to move forward and talk about the coronavirus. I just wanted to give you some perspective here. And this is taken from the Johns Hopkins Resource Center. As of today, there have been 2 million total confirmed cases of the coronavirus, 682,000 cases in the US, and 20,000 deaths in the United States. And in the state of New York, 7.3 thousand deaths. And in the state of Delaware, we've had 1,625 cases, 201 currently hospitalized, 51 in critical condition, and 35 deaths. Every day, we get constant updates as to these staggering numbers. How do we connect beyond physical distancing right now, preventing ourselves from going stir crazy as we social distance?
That's a really great question, and I'm really glad that you talked about those statistics, those numbers, because those numbers can be really staggering when we look at them outside of a context of other disease states, other experiences that people um, could potentially go through in life. Um, um, the numbers that you talked about um, were really significant, and really they sound very scary to me. They really
Yes.
sound scary.
Mm-hmm.
But one of the things that's also important is that while it's not the most fun topic to talk about, people die from a variety of things beyond natural death around the world and in this country.
Mm-hmm.
You know, you you and I talked about the number of deaths that people experience to heart disease. Those numbers are much greater than the numbers of people who are experiencing coronavirus. I believe it's the number that I last read was about uh, 647,000 Americans die of heart disease each year, which is 1 in 4 people. And that
Yeah.
number, you know, um, came also from the CDC, which is much greater than that of uh, the deaths from coronavirus. I think the other piece is that the number of deaths, um, the number one cause of death, um, you know, um, for one of the highest causes of death for young people is suicide. We think of things about recently we have heard so little about a topic that just covered our airways only a few months ago is opioid addiction and substance abuse, for which people there are well over 400 deaths to substance abuse last year, and that's been an ongoing number.
Yeah, in the state
Um,
of Delaware. Yes. Yes, that's
and that was
correct.
in the state of Delaware. Um, so it's really important to, as we, hear these numbers and hear the messaging that around coronavirus, to understand that while the virus, and I do not diminish the 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 uh, the power of a death of a person for any reason, and I honor those and my condolences to those who have had these kind of losses, is that it's also important to understand that the virus, prevention of the virus is something that we're much uh, is much easier to do, uh, and much of what we are dealing with is not only the pandemic of the virus, but also there's a parallel pandemic that I think we need to always be attentive of, is that accompanying hysteria or the fear or the anxiety that we've all heard about, the worry, um, that really prevents us from doing those many of those simple things that we know how to do very easily, and to keep ourselves safe, to keep our loved ones safe. Um, and those four things that we that have never changed in the messaging, for that matter, are doing things like washing your hands
Mm-hmm.
um, for 20 seconds with soapy water, um, not touching your face, particularly around your nose and mouth areas, um, and using hand sanitizer that's made of 60% alcohol.
Right.
Um, and social distancing, which I think is important to keep in mind, that social distancing is different than quarantining and isolation. Um, there was a
So just back up for one
mhm,
second. So just to clarify with our audience here, um,
yeah,
I just want to take this in perspective. What Mr. Norwood Coleman is saying, that a pandemic is a disease that is prevalent over a whole country or world. And we know that influenza kills about over 30,000 people a year. And though we're not saying that the coronavirus is not a virulent virus, we have to try to keep this in perspective and work within the existing tools that we have to keep ourselves healthy and safe. And you're talking about preventative hygiene practices. What other things?
hmm yeah, preventative hygiene practices, um, and really social distancing, which I think is very important. Um, it's uh, it's the practice of not of standing, 6 feet or more away from people, from other people, which is typically not something that we're accustomed to doing, but and it's not something that really feels very natural. Uh, um, but it's something that helps us at this point in the game to prevent the spread of of this virus, for the purpose of protecting our loved ones, ourselves, and really providing an opportunity for the doctors and researchers who are fervently working to find a vaccine and do the work to get that vaccine to all of us, to allow them to be able to do that work, uh, rather than having to put that work down, so that because we only have so many doctors and researchers and nurses and that sort of thing, and they would have to put that work down to attend to the needs of those who become sick.
Right. And then, just want to elaborate that there's other, tools that we have available through technology. In our practice, we offer telehealth visits, which is an opportunity to have a virtual visit with your healthcare provider as we continue to social distance. And sometimes those ailments can be mitigated without having to come into the office. And we definitely want to flatten that coronavirus curve by social distancing, because we know going to the hospital could expose you to even more germs and viruses. And we want to use the existing resources that we have and protective equipment for those who really, really need the care that they need at that time. So we have telehealth visits we can offer our clients. What other things are you guys doing?
Well, we're doing a lot of things. One of the things I think, and I want to back up a little bit, I think one of the things we all can really do, um, is, when we think about, I've stopped using the term social distancing. I think that's the popular term, and it's the term that the entire United States is using. But I've really begun to think about it a little bit differently, as thinking about, uh, first of all, we're not socially distancing, we're physically distancing. And I think that's an important piece, um, because we really are just connecting, you know, uh, beyond distance or across distance, you know, through the use of technology. And I think that's an important piece, because it's something that we've done and we're practiced in a lot, more than we kind of than this messaging has really presented to us. For example, um, my brother lives in a different state, so I typically do not see my brother, or and there's hundreds or a thousand miles between us most of the time. but we are not socially distanced from each other. We make phone calls. We use
Right.
FaceTime. We pull out a pen and paper and write letters.
Right.
Um, we text. Those are things that we do on a daily basis with our loved ones, even if our loved one is only a mile down the road, or I'm at work, or at school. Those are things that we do. One of the interesting things about social distancing is that, and that term, is that it feels so forced that we
Hmm.
forget that it's something that we typically do naturally. We stay connected.
Right.
um, we remain connected even when we're not physically in the presence of people, um, and I think that that's important. I think it's also important to remember that um, the distancing that they're talking about is not the distancing that typically happens between healthy family members that live in the same home. I think it's really important when we think about messaging that we keep in mind who is the listener. And right now, the whole country is the listener, and that includes uh, little children all the way up to, you know, our most revered elderly people in our communities. And you know, we want to be mindful that as we share the message of keeping others safe, uh, through physically distancing, that we also remember that safety is also about their emotional safety. Um, when you tell a child that we're not allowed to, uh, that we have to stay social, we have to stay 6 feet away from folks, it may be important to clarify that that 6 feet may not doesn't include their sibling that lives in the house with them, or their mother who prepares their meal for them, or their father who gets them up out of bed, or their family members that live in the house. I think that's an important thing to explain. I also, particularly with many of our populations that are at higher risk, there I think it's important to recognize and honor that they are at higher risk already because they have pre-existing conditions, which means that their bodies and perhaps their mobility may have already been limited. Um, and being mindful that um, we're we're thoughtful in connecting with them in ways through technology. And I think it's important that we don't limit our understanding of technology to the computer. That we still have telephones that ring
Right. We
in
haven't lost
everyone's
that
home.
opportunity to connect with people. Right. And FaceTime through your cell phone, if
Yeah,
you have a cell phone, right?
yeah, yeah. Well, one of the things that was interesting, I'll tell you a quick story. I was one of the members of my church community. Is She is in her 70s, late 70s, and she was so very concerned. She and her husband live in um, a retirement community, and that retirement community in uh, as a safeguard for reducing the spread had limited uh, visitors and contact with family members, so they really became very cut off from their family. And she had an iPhone,
Hmm.
and she never really knew how to use it. She used it, just to dial people to make phone calls, and that was it. And so um, I actually FaceTimed her by mistake. I just pushed the FaceTime button instead of the uh, phone call button, and she was so elated to see a familiar face with attached to the voice, and we sat and we chat really about anything that just came to mind, and even had time of just quietness in the conversation. But she was so excited that she could actually connect using that technology. and she was inspired to call all of her children because she didn't had never known how to use it well. I think it's important that we're mindful that, as we may know how to connect, that I think one of the important and useful things that we can do, even as we are physically distancing, is to remember that that's an opportunity also to connect and teach others that may not know the technology so well, on how to use it, by doing simple things like that, Skyping a friend, Skyping a loved one, using Zoom or some of the other technology like FaceTime, just to initiate the contact, and then using that call to even help them and walk them through how to continue to expand their ability to connect using that technology. I think it's really very, very powerful and important. These are some of the things that some people have been doing for years. It's just that now the whole world is doing it, and it's not a new space, but it's a space that we really have not had the opportunity to explore. And if there is a silver lining in this experience, is that folks are finding time and finding really creative ways to connect across distances that they may not have seen. And also, I think we're talking about it as a country differently. And I think that that's very important.
Yeah, and I really thank you for expounding on that and very eloquently, and just really impress upon the importance that physical distancing does not mean we can't connect to our loved ones and our family and friends. Just quickly, can you give the audience some other tips to reduce anxiety and emotional stress during this time?
Yeah, there's some really simple things that I think are really helpful, and others think are very helpful. Um, Exercise. Exercise is just something that we all can do. It doesn't have to be rigorous exercise, but moving your body for just 30 minutes a day, it improves the mood itself. It gets the blood flowing. And one of the things also about exercise, which is really interesting, is that we intentionally do it. And anything, particularly in a time when we feel like there's a loss of control, which is a big piece of anxiety, to be able to intentionally say, I'm going to do something and then do it, can really be very important and powerful. Another thing, and it's one of the benefits also of exercising, but we can do it without exercising because we do it all the time, is breathing and meditation.
Mm-hmm.
Um, uh, Breathing and breathing really is the central focus of many practices that surround meditation and yoga. But taking in a deep breath in through your nose for 4 seconds and blowing out for 6 seconds through your mouth, or whatever's comfortable for you. Not everybody has the same lung capacity, but that's about an average. Some people can do it longer, and some people can do it need to do it a little less. But to intentionally control our breathing can be really useful, and really doing that in a mindful way, noticing that even as we may have some real worries about the coronavirus and other things that are happening, recognizing that as we breathe in, I can breathe in that right now I'm safe,
Mm-hmm.
and breathe out that I'm allowed to experience good feelings. I'm allowed to be whole in this moment.
Mm-hmm.
And it sounds like a simple, and for some maybe even a contrived activity. And so for that, I say that, you can do the breathing and you can think of whatever you want. You can think of, a happy moment that you've had. You can think of maybe something that you're looking forward to in the future. you can think of something that you're grateful for. And that really comes to my next thing is writing a gratitude list would be a third thing that I put
Or a
on.
gratitude letter to someone.
Yeah, writing a gratitude. How about that? When we talk about connecting across distance, writing a gratitude letter to the person that perhaps we would like to connect with, um, uh, or we like to give them that hug, but maybe we're not going to be able to give them that hug right now. But sharing your thoughts and your feelings about how grateful that you are for that person, um, for the things that they are to you, and sharing that and putting that in the mail or sending that in an email can be very, very powerful. Um, and it's useful, and it's healing for both the sender and the recipient. To receive that, to send that to someone who may be isolated. One of the things I thought about, I think about, all of the variety of people that this affects, sending a letter to a stranger, sending a letter to you hear about this all the time, children writing letters to a pen pal at a different school or in a different community, or writing a letter to someone serving in the military.
Right.
All,
Or a nurse
all
or a
kinds,
doctor that's working in the hospital or in the emergency room or in the ICU.
sending,
How about that?
but exactly, sending a letter to a healthcare provider that is out on the front lines every day, to keep, not only keep us protected and safe and be a part of the healing process for the COVID-19, but also for all of the other things that people go to the hospital for. And those folks really are just heroes. And recognizing how grateful we are for those folks who dedicate their life and leave their homes every day to go do that. That's a wonderful suggestion. But a gratitude letter is a wonderful way to express that. And we do that when we write that letter, we write it in real time. And that's so important, because when people receive it, they receive it in real time. And that's a wonderful way of connecting, and reducing that sense of anxiety. Um,
Wow.
I,
Well, Norwood, have to wrap up shortly. Would you like to finish up what you're saying? And then I want the audience to be able to, if they need to connect with you, I want them to be able to get information about your practice and what you do.
Sure. Well, I think just the one thing that is really important is for folks to really take time to really appreciate, their loved ones. I know we have a lot of parents who have become not only the nurturer in the home, but now they're the school teacher and they're the
Yeah.
aftercare teacher.
Mm-hmm.
And that can be very stressful because it's a role that they may not have been, prepared for. Um, but one of the things I think also is that they also are, one of the things that really helps us is, drinking water, staying hydrated, and uh, and doing your best to eat a balanced and healthy meal, and uh, getting to know some of the resources that are out there, that if you're having trouble with accessing some of those things, to get to them. I know that we at the Life Health Center, we have in addition to our counseling services and our medical services that we have a really wonderful team of folks that help support connecting to social services. There's also 211, which is a great resource for connecting to services in the community. There's also the United Way, which is a wonderful organization, and there's so many more that provide just great services and help people to connect. And I would just be mindful that during this time, I think one of the best ways that we are able to connect and build these quality relationships that we really are all able to create is to remember that we have the ability to be patient in a variety of ways. Be patient with each other, be patient with our families, be patient with the workers who also are struggling as humans in the same environment to do and try to do the work that we would like them to do. There may be longer wait times for phone calls or emails, but folks are doing their very best. We still, let them know if there are ways that we can, if there are ways that they can do it, but we want to do it in supportive and solution-focused ways. And remembering that these are the heroes that they're doing the best that they can to keep all of us doing well during this difficult time. So I think that patience and gratitude, breathing and eating a healthy diet, and finding time to meditate and exercise really are a wonderful beginning that everybody can elaborate on, can personalize, can expand to really help reduce a lot of the anxiety. Just having a conversation like this with a friend and being able to share thoughts and listen is it's a wonderful way of slowing things down. And so I thank you, Dr. Nina, for this time. If folks are more interested in learning more about the work that
how can they find out about you?
Yeah, so they could visit us at the Life Health Center website. Our website is lifehealthcenterde.org, and we have some wonderful things happening. One of our director of medicine does a weekly webinar on the facts and clarifying the facts and the fictions and myths about COVID-19, as well as ask and answers questions. We do telehealth services for children and families. We are continuing to do our work providing wellness, prevention, and social-emotional learning groups. Actually, we're using telehealth to do that, which is really cool and fun. So as well as we have, we still have our substance abuse, our medical assisted treatment, and our family health things. So we're doing our best in this difficult time to make sure that even as the community continues to work through this, that we're doing our best to show up and honor their walk through this as we honor each other's. So, yeah.
Thank you so much, Mr. Coleman. It's been great having you on today. And I think the audience has got a greater perspective about the importance of being mindful and being present in this time of pandemic, and that there's many different ways that we can really help to stay healthy and well from a holistic perspective. And I thank you so much for coming on our show today. I want to wrap up TOVA Tuesdays today. We had Mr. Norwich Coleman, licensed clinical social worker. To find out more about TOVA and the work we do as a primary care specialty clinic, you can go to our website at www.tovacommunityhealth.org. You can also like us on Facebook or Instagram at #TOVACommunityHealth. This ends our TOVA Tuesdays. I want to thank you all for joining us. I hope you are staying safe, healthy, and well. Take care.